Good morning. Can everybody hear me? Thank you. I have no glass to ding, 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 but I hope everyone had a breakfast with your own county representatives, your state representatives. And good morning. This is, of course, the emerging strategies in addressing poverty, discussions of key issues, policies, and platforms affecting poverty and well-being in rural America. So welcome. I'm Pat O'Bannon. I am from NACo County, Virginia. I'm very careful when I say that, and I'm going to be very careful when I pronounce everyone's name because everybody says it's Henrico. No, it's Henrico. I know all of you have places that are special to your neighborhoods that everybody pronounces them the way that they should be pronounced. And if you Google Henrico County, you'll see a quote from me that says, "You pronounce it the way the people live there pronounce it." Thank you for joining us this morning. We have a great and knowledgeable panel for you to listen to this morning. You're going to hear from these leaders and experts who are working diligently in their counties to combat poverty. And they're addressing needs and creating opportunities for children and parents. And we think their stories are going to be impactful for you. If you can take notes or if you've got your iPad out and you want to type it in, please get those out and get your pen ready if that's the way you take notes. Our moderator for today's discussion is Dr. Kamara Jones. She's there in the end. And she's a senior fellow at Satcher Health Leadership Institute and is an adjunct professor at Morehouse School of Medicine. Her work focuses on the impacts of racism on the health and well-being of the nation. She's also a family physician and epidemiologist and the former president of the American Public Health Association. Obviously, health and poverty are very connected. Also joining us for our panel, we have Commissioner Rebecca Benally. Good morning. And she will be our first presenter. Mr. Jim Wallace and Ms. Darlene Hammond. Rebecca Benally is the county commissioner from San Juan County, Utah. Most people know her as a parent, educator, school administrator, and community member who supports youth, elders, veterans, women, educational equity, and economic development. Commissioner Benally's civic duties include the San Juan County Mental Health Board, San Juan Blue Ribbon Committee, Navajo Nation Board of Education, and National Congress of American Indians. Jim Wallace, sitting next to her, is the county administrator for Herkimer County, New York, where he is responsible for day-to-day implementation of county policies and procedures. In his capacity as Director of Employment and Training, Mr. Wallace has developed, implemented, and coordinated the training and development programs for economically disadvantaged, disabled, and dislocated persons. Darlene Hammond is the strategic planning coordinator for Herkimer County's Integrated County Planning Program. In that capacity, she is responsible for engaging county leaders and community stakeholders in the planning process, coordinating data collection efforts, completing strategic plans, and advancing identified priorities from talk to action. So we're going to begin with Commissioner Benally's presentation, and we'll move on there, and with our moderator moving us through the presentations. Again, get out your pens and your notebooks or your paper or your iPad or whatever you brought, and get ready to take notes. Commissioner Benally, you have the floor.
Good morning.
Good morning.
Good morning.
Yat e bine. That's in my native language, Navajo. Ya means the heavens. Yat e means greetings. So greetings from the heavens, from the Four Corners area in God's country. I'm delighted to be here with you today. I think this is one of the more important sessions because it takes all of us boots on the ground, back home, statistically, and how we use our titles to influence people in our communities. San Juan County is one of the poorest counties in Utah. So there's Ute Indian Reservation and there's Navajo Reservation within San Juan County. San Juan County geographically is the size of Rhode Island. So it's a huge area. So from one end of the county to the other takes 3 hours. So it's huge, but there's 15,000 population. Just to give you an idea, the unemployment rate on the reservation side of the county is anywhere fluctuates between 47 to 42% unemployment. And so 1 in every 3rd child is affected by poverty, whether it's intergenerational or multi-generational poverty. So I'll go through this slide with you to give you some idea. Utah is unique in one of the few states. The state of Utah, state legislators had passed a legislation in 2012, Intergenerational Poverty Mitigation Act. So what the Lieutenant Governor, it's under his direction, created a 5-agency, Department of Workforce, Department of Health, Human Services, Utah State Board of Education, and Juvenile Courts. So that consists of the commission. So that's the umbrella for the state, and it goes down into the counties. We have 29 counties in the state. So there's a regular annual report for tracking system and many collaboration. We can collaborate, but what we found the most important part of collaboration is communication. Sometimes we're in silos or in isolation, so it got us to have this interagency meeting where everyone is talking. It could be in the next office and the next building. People just don't talk to each other because we're territorial, but it made us talk between agency to agency, counties to counties, in the state of Utah. Utah defined intergenerational poverty by separating it from situational poverty. Poverty in which 2 or more successive generations of a family continue in the cycle of poverty. It's measured through utilization of public assistance for at least 12 months as an adult and 12 months as a child. Situational poverty is generally traceable to a specific incident or time period, such as divorce, illness, job loss, or loss of a loved one. So at the county level, we were asked to develop a plan. And we didn't want this to be just another plan that we do and it sits on the shelf and maybe someday somebody reads it. So we were tasked and we met with the Lieutenant Governor. He came to our counties. So the 4 pillars in our county was early childhood, job creation and training, connecting with colleges, because across the country, it seems, I'm sure it's not unique just to our county and state, is that a lot of our high school graduates want to get out into the work field. So they're trending to go more towards technical colleges to get a training and to get out in the workforce. So our county is no different. While that is good, our local high schools on the reservation side, they experience a high school dropout 40 to 50%. And you go 40 miles up the road in the counties and the other towns, and their high school rate, graduation rate is 80%. So to connect those communities and do a better job of graduating our students. So we figure if we focus on early childhood and also parent training with the parents, and they know education is important, it's just priorities are backwards sometimes. So those are some of the ways that the state has worked with counties and then at the county level. So having been a school principal for many years, I face the parents every day. And so knowing that, it helped as we were moving along with creating these plans. Who in intergenerational poverty, who are they? There's 39,000 adults and 59,000 children experience intergenerational poverty. 26% of adults receive public assistance experience intergenerational poverty. 29% of Utah children were at risk for remaining in poverty as adults. So that's where the multi-generational or intergenerational poverty, how do we break that cycle? What are some of the things that we do? So what we found through surveys and just talking to families is that these are people, a large percentage, it's not that they don't want to work. They want to work. When the men in the family can hold a job and provide for the family, that's the greatest gift that he can give his family, to be a provider of basic needs for the children. That brings self-respect. It's just a happy home. That's not to say that there are single-parent homes, whether it's the father or the mother, but if they can have jobs so that they can provide their families, it's a different home, and there's role modeling, positive results because of that. So that's statistically some of our some of the ways that we've worked with intergenerational poverty. The last annual report was released in September 2017 to share some of the collective data from the 5 agencies. It also explained the local county efforts and positive improvements made in 4 focus areas of child well-being that affect intergenerational poverty. As I stated, 1 was early childhood development, 2 was education, 3 was family economic stability, and 4 was health, as was mentioned earlier. Health coincides, interrelates with health. It could be early teen pregnancy, making sure that they have access to health care, nutrition, parenting, education. So those are some of the areas that we had identified. I'm sure a lot of these are true across the country. But because our county experiences such a high unemployment rate, we focus on bringing jobs and job creation in our county. Intergenerational poverty, I did a little bit of work when doing my thesis in college, and studied a lot of Ruby Payne's work and understanding that there is this generation of poverty, but then there's subcultures. And it took me a while to understand what some of those subcultures were, but there's still a lot of area to research and discuss through the years. So the state recognized that intergenerational poverty cannot be solved entirely at the state level. So we looked at some of the areas that we could bring people together, and that was local leadership working together to determine what works best in our community. So it's not a top-down, a cookie-cutter model that we're supposed to bring to our county and try and make it work, but it was the county developing these plans. So in 2016, the commission that was led by the Lieutenant Governor visited 13 counties across the country who had highest rates of children at risk for remaining in poverty, and 2 urban counties that were addressing intergenerational poverty. In 2017, each county put together a local committee and created a strategic plan, 1 at the county level and 1 at the state level. In 2018, Utah legislature approved $900,000 for county to receive grants to implement a strategic plan to reduce intergenerational poverty. Counties are currently in the application process, so our county had put together a plan. It's not so much competitive, but it coincides with the plans that we have. So just to stress that our state legislature, as well as the governor and the lieutenant governor, are serious about addressing intergenerational poverty in the state of Utah and then into counties. Utah success. There is still a lot of work to do in Utah to help families in intergenerational poverty. The recent efforts by the state and counties have been successful at the following. By just forming local committees, several members have realized that their services were being duplicated. As we can probably see, some duplication of services. So we looked at all these different agencies, the workforce, Department of Health, where are those overlap and where are there gaps? So I think all of us can realize that if you're duplicating services, there's a waste of services and dollars. So we took a look at that to see how we can better serve the communities. Overall, the counties have seen an improvement in communication. Communication is really important. Like I said, we all like what we do. It's the greatest programs, and sometimes we become territorial. So I think it's led us to believe that working in silo is not as good as working together, collaborating, and communication. So better strategic decisions have been made based off shared data among state agencies. Just to give you an example of how one of those interagency collaboration work services and human services prioritize schools participating in school-based behavior health plan by using intergenerational poverty data to identify schools with the highest rates of students in intergenerational poverty. As a result, an addition of 8 school districts, 57 schools, and 5 charter schools now have school-based behavioral health specialists that didn't have them the previous year. And not only do they address behavioral issues, but also they work somewhat as a social worker and connecting them to services. So in the early childhood programs, there is a parenting component to it, so that to break that cycle, we have to address them at giving them a good start, whether it's literacy, whether it's health, whether it's pre-K, pre-kindergarten skills. And so it's made schools look at being the main hub of communities, whether we like it or not. And what does education say? We're the local parentis, meaning we're the parent during the day to the parent to the students. So with all these efforts in our county and the state, it has, we'll go back to this one. So overall, families caught in the cycle of poverty are at the top of mind in Utah due to the attention of state and county officials and community organizations. If you'd like to learn more about intergenerational poverty, Utah activities, or view the annual report and the state's plan, visit intergenerationalpoverty.utah.gov. And here's the information that you can have. There has been the 5-year plan and then working on the 10-year plan. So you're welcome to take this information down. We do have a report, like I said. And so, as was mentioned in some of the other sessions, and as the president of NACo has indicated, one of his mission and one of his goals was serve the underserved. And to address intergenerational poverty, if we can help that parent, if we can help that single parent families, and sometimes even though 2 parents are working, is not sometimes enough to go beyond providing just the basic needs. And the Native American communities across this country continue to experience poverty, but are rich in culture and heritage. So I think we have to understand that while they may be materialistically impoverished, it seems, but they're rich in their culture, they're rich in their heritage. So that's probably a place to start, to have that parent and provider in a home creates that respect. Because if it's not a happy home and it's always in need just to provide that basic need, it's not a happy home. The children suffer, the parents suffer, depression, all the social ills. And so visiting families home to home and letting them know this is not just another grant. This is not just another grant that's coming through your community, because there are some distrust in some of these families. Is it one more grant that's going to go away? I'm going to participate 100%, and I'm told in 3 years that this program is going away because it was a grant, and sorry, but thank you for participating. So even that is a cycle. So we have to be careful how we present these programs so that it's sustainable in each community, and so that we build trust, and to bring self-respect. So with this, I leave you the word of serve the underserved. And thank you so much for listening to me. And I've committed myself to another session, so I'm going to have to leave, and please excuse me. So it's been great to be here. NACo is always wonderful, networking and getting to know everyone. And thank you so much for what you do for your communities. Thank you.
So now we invite Mr. Wallace and then Ms. Hammond to present on Herkimer County, New York.
Thank you so much, Dr. Jones. Welcome this morning from upstate New York, in particular Herkimer County. We're a small, rural, conservative county in upstate New York. The major economic factors of the county are tourism. We're the gateway to the Adirondacks, if anybody's familiar with the Adirondacks, manufacturing, and of course agriculture, very important to us. New York State implemented about 20 years ago, and yes, I was around 20 years ago. Darlene was there, but it's harder to believe. And again, anytime you get a mandate from the state, you're always wondering, geez, you know, is this something we should buy into? As Rebecca said, is it going to be around tomorrow? Because I've been around for 40 years. I've seen a lot of things come and go. But our county bought into integrated planning 20 years ago. And that'll get to, you know, you'll understand where we're going with this in a few minutes. But our integrated planning process has stayed together for 20 years. We had a very good victory early on for our kids, our families in foster care, and also the taxpayers. We were able to reduce our foster care caseload from 134 down to 64 using our planning process. That saved us about $2 million. And for a small county with a $100 million budget, that's a lot of money. So we got buy-in from our legislature. In New York State, you're either a board of supervisors or a board of legislators, our local legislators, that really gave us some good buy-in. So I think with that, I'll pass it on to Darlene.
Can everybody hear me okay? Okay, great. As Jim mentioned, our Herkimer County Integrated County Planning process is a county-led initiative with, oh, you can't hear me now, I'm sorry, with stakeholder involvement from across all sectors, focused on the collaborative identification of needs and priorities, and the development and implementation of strategies that address needs and maximize resources. And I think one of the ways that this planning process excels is that we are outcome-based and results-oriented, which means that we on an ongoing basis, we measure what has happened, have we moved the needle, and if we haven't, we change our course, and also what are new and emerging needs. Thank you. Some of the committees and task forces that have been around for a very long time are our Integrated County Planning Steering Committee, which includes our legislature, administration, and county department heads. And then we have various task forces that include a number of people that focus on specific areas that we've identified as priorities in our county. Thank you. We have over 85 organizations that participate in our initiative, and that is about 120 people, because at various committees, some, levels of, for instance, school superintendents may serve on one committee while we have counselors and social workers on another committee. But basically, these 85 agencies represent county departments, legislature, county administrator, school districts, law enforcement, nonprofit agencies serving youth and families, economic development entities, parents, community members, and organizations like the United Way. So other conveners are at the table as well. And as Rebecca mentioned in her presentation, communication is everything. So everybody's talking to one another, which certainly helps. I think the next two slides, actually. We are definitely data-driven and results-focused, and we've been at this for a very long time. Every 3 years, we do a comprehensive needs assessment. It's called the Herkimer County Risk Assessment Profile. We're in our 6th publication of the document. We started in 2000. The data is organized within 6 life areas. If you're familiar with the Kids Count, Annie Casey Foundation, the 6 life areas, or in New York State, the QUIC, the New York State Touchstones, we have organized around that data. I'm going to lift up a copy of our document, and I need 2 hands. This is a copy of the data profile that we publish every 3 years. I don't like it very much because I'm the one that's in charge of kind of convening or getting this data together. Other people do use it, though, from what they tell me.
Absolutely.
Okay. All right, so we keep doing it. Fortunately, unfortunately, I'm not sure. We use the data to assess the scale and scope of county needs. Like I said, the most recent one was published in 2016, so that begins our process of looking at the data again. Our Integrated County Planning Steering Committee will use the data to identify their priority areas. And as you could imagine, they don't change much from profile to profile, although we do have emerging needs in areas, and you'll see our list shortly. Focus groups convene to talk about the data immediately after. We include those committee members, but we try to get out into the public more. So for instance, there was a teen group, a youth group formed recently to talk about economic issues and dropping out of high school and how they re-engaged and got back into the workforce and what would be helpful to get them there. And then, of course, we implement strategies, and that is with the help of our committees. And then we measure our progress using a system called results-based accountability. That's with the Clear Impact Group. How much you do, how well you do, is anyone better off? All our county departments, all their contract agencies use that tool to measure their data. We have about 1,000 indicators, I think, that we measure. And then if we take a look at our needs and then we take a look at what we're doing, and if they don't match, we're going to make changes in the program areas. So the next slide should show you our 2017 priority areas of focus. It's a long list. The opioid overdose rate, I can tell you, did not make the list 3 years ago. It's a priority focus now for our mental health committees, certainly. So that kind of goes to show you we change over time. Some of them, unfortunately, have been there for a long time. Poverty is one of them. We were talking about poverty in 2000. We're talking about it today, certainly. And so we went through this process in 2017. Our committees began to work, and then we became aware of the Rural Impact County Challenge through NACo. And we were fortunate enough to be selected as one of the 11 counties to participate in 2018. And so what that has allowed us to do this year in 2018 is to convene a group that is kind of steering this process within Herkimer County. And we're getting community coaching, and we're part of an action learning collaborative through the County Health Rankings and Roadmaps program, and that's been very helpful. So we're focusing on the social determinants of health and well-being. We have for quite a long, but we're placing a greater emphasis on that. And we narrowed down our areas for the purpose of this initiative to 3 areas that we're moving forward with. And one is increasing the availability of quality, affordable childcare, increasing the number of children that are ready for kindergarten, and looking at the number of youth 16 to 24 that are not in school and not working. So the next slide just gives you a little bit of background information on what we look like in Herkimer County related to these areas. As far as childcare is concerned, we only have 1 licensed daycare center in Herkimer County. It wasn't year-round until just this year, and that was through the encouragement of some of the work that's being done. We have absolutely no infant licensed childcare available in Herkimer County. So if you're pregnant and you're working in Herkimer County, you most likely won't be after you have your child if you don't have access to a family member or you can travel a great distance for services. And one of our agencies, the nonprofit agencies, did a survey, and they do it every couple of years now, and they found out that in order for us to meet our needs for regulated childcare in Herkimer County up to age 6, we would need 314 more childcare slots, which would be very hard to attain. Children ready for kindergarten, 23% of boys and 18% of girls were identified as not being ready for kindergarten. This is through an assessment that is done entering kindergarten, a uniform assessment within 10 school districts, and that has happened based on the need and the communication that has happened over the years in our county planning process. The United Way Ready for Kindergarten initiative was born through a literacy coalition that formed about 10 years ago, I think, and that includes all our school districts. So they're on board now talking about this and ready to take more action. Readiness scores, we found, interestingly enough, were significantly higher for those who attended preschool. That's not a surprise. But what was a surprise, for example, was for boys, 80% were ready if they attended preschool, and only 53% were not. 53% were ready if they did not attend preschool. So we knew we had an issue there. We want to get more kids out there and engaged. Our Best Start Committee was identified. This is an existing committee. It was on the other list. It's been around for about 10 years, focusing on our children from birth to age 5. They are taking on the childcare and the kindergarten readiness issue. And it's chaired by our public health director, again, county-led. And then it includes all school districts and nonprofit agencies, childcare serving agencies, and economic development entities, because we're talking about this helps people get back to work. This is good for the economy in Herkimer County. Next slide. Some of the strategies that have been identified for implementation, and in the area of childcare, it's very, very exciting. We are in the process of, I guess you would say, in almost the implementation phase.
A couple months away.
Of building a childcare center in Herkimer County, which is wonderful, yes. And it will have 60 slots from infant to school age, but we will have those coveted infant care slots that we've been looking for a very long time. It's a partnership between the county, Herkimer College, which is actually a 2-year college in Herkimer County, and a nonprofit agency who has taken this on. They're looking for NACo, and I hope I'm saying this right, certification, which is a very high standard for education for childcare centers. And we're currently scouting locations.
Absolutely.
And always capital funding.
And the Community Foundation is out there looking to give us money to build a facility, so that's fantastic.
It's wonderful. One of the second areas they're looking at in this area is engaging the business community a little bit more. So there's a Chamber of Commerce event that's scheduled in October 2018, excuse me, a national speaker is coming in. He's a business executive. He's going to be talking to the group about the importance of childcare as it relates to keeping a very strong and stable workforce. So we're really looking forward to that. As far as expanding the Ready for Kindergarten, we're looking to expand upon the work that's already being done by the Ready for Kindergarten initiative. We're looking at putting more outreach workers in schools, doing more engaging parents when they have their child to get them involved, get them into preschool, structured daycare, so they're actually ready to learn at kindergarten. And we're also looking to expand parent education programs in the community. One of the newer groups is Disconnected Youth and Middle Skills Development. There's a leadership team that's currently forming, and Jim.
Yeah, as I mentioned earlier, I've been at this 40 years, and we've had an awful lot of great cooperation between agencies, the United Way Community Foundation, the schools, police, et cetera. One of the areas where we've been a little bit lacking has always been business, Chamber of Commerce. And again, not that they weren't interested, but it just wasn't a priority for them. What we're really seeing now is with the shortage of workers in upstate New York, especially in Herkimer County, I think we're at a point where our needs and their needs are meeting. So if you look at this list, it's a lot of the same groups we've always dealt with. But I think two of the big extras are the Chamber of Commerce jumping in and also our Industrial Development Agency jumping in. And also two of our biggest employers are ready, to put their money where their mouth is, which is to us is a big step for us. If I go to the next slide, the focus will be to ensure that youth have the education and skills necessary for self-sufficiency as adults. We believe that 16 to 24-year population, which we've been dealing with for a long time, we have about 1,300 kids, 16 to 24, in a small county that are not working and they're not going to school. So we really need to engage those people. Promote technical jobs and skills development at an early age. Develop employment opportunities that incorporate education and skills development. This is a somewhat new committee. Our current activities, again, as Darlene has alluded to, data is very important for us. So comprehensive data review is going on. I think Darlene mentioned earlier, we're doing focus groups with some of our disconnected youth and also some of our summer kids in our TANF programs to get their input. We're completing a resource inventory. We're looking at different skill building initiatives, and we're trying to identify best practice programs that combine education and on-the-job training.
We also have that newly started this year, our Youth and Young Adult Task Force, which is looking at specific employment and life skills development for our at-risk youth that we know we already serve. So we're looking at the kids that are involved with our Department of Social Services, our Department of Mental Health, runaway and homeless youth, all the programs and services out there, employment and training. We're trying to engage also their friends, because they have an extensive social network themselves, to engage to get more comprehensive and collaborative services. This is chaired by our DSS leadership as well as employment and training. And our first tasks are to create a forum for communication, obtain the youth and young adult input, and create streamlined referral processes. This is already happening, and I can tell you people thought they were doing it before, but we're trying to capture every single kid age 14 and up in Herkimer County that is an at-risk youth, and get them life skill development training, get them employment skill development training, so they are more prepared to enter the workforce, college. We're also trying to get cross-training in, because as Rebecca stated prior, you don't know what you don't know about the other programs and services, so you certainly, when you get together, you realize that you really need some cross-training to occur. So that's where we are right now with this group. And it's a very exciting process, and we hope that the outcome is that we're able to finally do a little bit and reduce poverty in our county and get more people to work. Thank you.
So here are some questions. So I actually am here in two roles. I would like to jump into the moderator role first, although I was also invited to bring some comments of my own. But this was such a rich presentation, and I'm sorry that that Rebecca Benally wasn't there. But do you all have any questions right now for our representatives from Herkimer County? Because I had about 5. Do you want me to start and see them, or do you all? Okay. Well, I actually had a big observation from both presentations, and that is often we think about addressing intergenerational poverty with services to individuals or services to families, when in fact, intergenerational poverty is a manifestation of structural causes. And so I guess the question I would put to you all would be, how would a recognition of structural causes, how could you do generational investment in changing opportunity structures as opposed to trying to treat at-risk youth or at-risk families one by one with services?
We try to do that all the time, and I got to be honest with you, sometimes it's very frustrating, but once you develop, I'm sorry folks, once you develop a relationship across sectors and you do it over time, it becomes the way you do business. But I have to tell you, we sometimes bend, should I say this? I don't know. But state laws, rules, regulations sometimes keep you in silos when
Yes.
you're working with people. So that is an issue sometimes, but we try to break that down. We also work with our state partners to say this doesn't work very well the way it's done. And we usually, when we go through our needs assessment process, we talk about, we call it a resource inventory. What do you do? What can you do? And what can you ask someone, if you could do, if you're willing. So we try to wrap services in an individualized fashion around the person to get them the services they need. So I don't know if that's...
Yeah, it is, but it's a hard... It's a hard thing. And this is so impressive what you're doing. But so another little question that I had, that I'm hoping that you all are thinking of your own questions. For example, a structural approach, you have all these sectors and all these people at the table. You are involving the youth, I saw both in focus groups to get their input, which is very important, and a youth board. You didn't talk about this, so maybe you could talk about that more, but are youth permanently at those tables, like over 20 years? Do you have a youth voice at the table? Because so much of a structural approach would be who's at the table and who's not.
We have had youth at the table, and they've said at times, oh my gosh, I'm overwhelmed at this table. The youth board is a new creation by the Runaway and Homeless Youth Program. They're engaging youth. We recently had a focus group with our 16 to 24-year-olds. We actually had a couple folks who might be interested in returning to the table. So we've had people come and go over time. I guess I should say that. And some kids, they're there, they're participating. We have a youth summit every year, so there is an opportunity for teams of 8 youth to come together and identify issues. We take those issues, our Youth Violence Prevention Committee, and actually work with those issues. We used to have something called an adult summit that would have adult working with youth, but we've kind of evolved. Like I said, we've kind of moved on to a different kind of space. We're more of an evolved collaborative planning structure, but we really, your point is well taken. We're hoping that some of these youth will come back to the table.
Don't forget the tabs for me.
Yeah.
Are there any questions from you all sitting there right now? Yes.
Thank you for your presentation.
There's a microphone coming to you as well.
Thank you for your presentation. Brenda Howerton, Durham, North Carolina. We do a lot of innovative things, and we do all of the data-driven but I don't see the needle. What I hear from my community is you're not doing anything to impact our lives. You are doing research and analysis. but it's not shifting the needle. So I'm listening for strategies that are moving the needle.
Well, it's akin to what the question I was asking as well. And it's hard. I don't think that we'll necessarily have all the answers here at this table or even here in this room, but I would like to address that. To move the needle, we have to, there are three things we need to do. We need to value all individuals and populations equally, and we manifest that value by who's at the table, who's not, what's on the agenda, what's not, all of that. We need to recognize and rectify historical injustices, and often we as a nation are ahistorical, and we're trying to solve problems without trying to figure out how did this problem come to be that way. I might even recommend that a historian be part of all of your different committees, and that county commission meetings or whatever, that we have a historian, or at city council meetings, so that when a problem like teen violence or dropout or disconnected youth or infant mortality, how did that problem come to be that way? Because by understanding the historical roots, you have a better chance at solving it. So that's the second thing. One is valuing all individuals and populations equally. Second is recognizing and rectifying historical injustices. And the third is providing resources, not equally or a little bit here or when, the loudest, the squeakiest wheel, but providing resources according to need, which depends on establishing some metric of need. So you have the data here for the metric of need. But here's a question about that. You said that you guys need 314 slots for daycare. You are building a daycare center that will have 60 slots. So the question will be, how will those 60 slots be allocated? Will there be some kind of metric of need and the 60 neediest? So this would be an excellent example. Can you talk to us about that?
Yes. Yeah, actually, we've talked about that a lot. We're working with state partners right now to see how far we can push it to try to weave in our most at-risk individuals, particularly those families that have a history of their children being removed, indicated child abuse and neglect rates, getting them into the services so that we can break that cycle, that we can give the child the tools they need while giving the mom and the dad or whoever the parent is, whatever services they need to move forward.
And just to jump in, I talked a little bit about the foster care success we had years ago. We're hoping we have that same success with these 60 kids and their families. And I think if we see that success, I think you'll see another investment in another 60 slots within a couple of years.
And so the question, so then, were there other questions out here? Yes. Yes.
So let me make sure
Microphone.
Thank you and good morning. I came in a little late, but this question refers to the number of childcare slots. That number is 360.
Well, they do a child care needs assessment on the Child Care Coordinating Council, and that's what they identify based on the population, what they think the needs are, and maybe some waiting lists they might have for other types of child care. There's informal care, there's other types of daycare like family daycare, but the most enriching experience will be in a child care center.
And it was 314?
Yes.
Was it 304? Okay, so maybe I missed this portion because the strategy with that number of slots that need to be available, then why is it not built through the school system to take an entire hallway or classroom structure to just add those slots? That's very quickly how you can move that needle, by building it into the actual educational program itself to just do one fell swoop of it. I'm sorry, did I miss that?
No, we're talking about it. Certainly, we're talking about it. We're working with it. We have a couple of great, motivated school district superintendents that are where you are right now. And we are trying to expand the services and talk with people. What we'll do is we'll measure this, and we won't wait for 3 years, by the way. We do it every 6 months. We measure it and we say, okay, we've done this. Now what? And that's what Jim was saying. And we'll do a lot of different things. We'll engage businesses. We'd like to see childcare in businesses. If we have large employers, we'd like them at least to invest.
I talked a little bit about that. Two of our major employers are that they get this now. They understand this now. They're watching us very closely. They have staff that are in touch with us on a regular basis. So I think that's an option as well.
But it's an important question, because if you recognize you said 314 slots are needed, and you're not providing resources according to need if you only build 60 slots. So those three principles for achieving social equity or health equity: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need, might be a way for all of us to say, well, is what we're doing sufficient? Is what we're doing addressing the issue? Should we do more now? Right. Feel a sense of urgency. I would say, I know you do. But I want to get back to this. Certainly. I see there's one more question here, but I want to get to the question of at-risk youth, at-risk families. It gets back to, are we trying to serve people who are at risk and identify and serve people at risk, or are we trying to eliminate the risk? It's a different strategy. Right. It requires different investments and people at the table, and I know you're trying to get that, but it's a whole different strategy. Services for at-risk people and communities versus eliminating the risk. So let's take the next question, and then let's all figure out what could we...
Sure.
Yeah. Mm-hmm. Yeah.
Hi, my name's Nancy Shockley. I'm from a small rural county in Maryland, Dorchester County. And Herkimer, I'd like to say thank you. We actually mirror almost identically the work that you're doing. But my question is, one of the challenges that we have identified is actually twofold. It's community engagement strategies and family engagement strategies. When you're talking about that early childhood readiness piece, what types of things have you done to engage the broader community in getting a better understanding of intergenerational poverty and moving those strategies forward?
There is a current initiative, and I didn't speak too much about it. They're called Parent Jam Sessions, and they're bringing in, this is, by the way, school districts with their school resource coordinators that currently exist in a couple of our largest and most diverse and with economically school districts. They're bringing in parents from across the school district to have some food and some fun and a little bit of information and linkage to services if they need them. And that has been incredibly effective already, and we've only done it for 2 years now, to engage some of those families that traditionally would not come in and sit, because we did adult summits back in the late 90s, early 2000s. We got out there, we publicized them, we talked about these issues, and no one came. Honestly, no one came. And it was probably because they were too busy working 2 jobs or taking care of their family. It just wasn't effective. So now we're trying these new strategies, and it's not perfect, but we try new things, and if it works, we stick with it, and we expand the scale. And if it doesn't work, we measure it, and we kind of move on. But the jam sessions really, really work. So we're looking at funding right now to expand those. It's already been expanded to 1 additional, so we're up to, I think, 3, maybe 4 now, but we want to get them in all of our 10 school districts. And we also want those school resource coordinators. They're going into a family at birth. They're saying, hi, nice to meet you. We're here. We'll call you in a couple months to see if there's anything you need. Just something that simple, developing a relationship, has really changed things for our poorest school district. And a guy who came in that got hired 2 years ago, who had a caseload of 10, has a caseload of 120 right now. So that just goes, that's one of our strategies.
How do we make those poorest school districts not poor school districts?
Right, you're right. You know what we're hoping? You know what we're hoping? And this is the truth. Yeah, no. What we're why we started? Oh, okay.
I'd like to know why we started, because I think that is the question we don't want to acknowledge.
Right.
Why we started.
Well, in New York State, the Department of Social Services and the county youth bureaus were merging. So there was an opportunity to be a part of a pilot study. And we were one of 15 counties selected across the state to do something new called integrated county planning, which would look at all kids, not just the at-risk population. Look at identifying a mechanism to collect data, measure outcomes, to look at what promising practices and approaches are out there to address needs, because they are. And I know, I think from Durham, the woman from Durham said, you know, what do? We usually get the data, look at the resources, identify our gaps, and then go out there and figure out what other people have done already to, you know, maybe try to move the needle in that area. So we got started with that. That was a 5-year project, 1998 to 2003. We now have something called the Office of Children and Family Services. That is the overarching umbrella. So we stayed on because we thought it was effective, correct? So that's how it began. And you said, how do you change that? We're hoping that in our discussions with the Economic Development Group, the middle skills, we want to give kids skills. We want to identify what kids are out there, what kids are disconnected. We want to create something. We've talked about a vision of having maybe some of the industry, and there isn't much industry in Herkimer County.
Well, we tried it, I'm going to say 4 or 5 years ago, we had companies promise slots, you know, give us machinery, working with our BOCES and our community college. It was a great program. We got 1 kid interested. So,
but how could you get the economic folks to invest in Herkimer County? So that that is...
We're doing it now.
Dr.
That's
Jones,
what we're gonna do.
I think we're kind of coming together here.
Okay, good.
Because as an upstate county, we know we've lost hundreds of thousands of people due to taxes over the last how many years. So our employers, we're having companies look at upstate New York, want to come into upstate New York. There's we just don't have, people ready. So when you're talking about childcare, when you're talking about getting 14 to 20, 4-year-olds ready to go back to work and go to school, and there's all kinds of needs there. And I think what I mentioned very briefly is our 2 largest, one's a manufacturer and one's a distribution company, is very interested in participating, and will have some skin in the game.
Yes.
And for us, that's a first for us. I mean, maybe $100, $500, $1,000 before, but we're looking for, an investment here, and I think we may see that.
That's what it takes. We're going to be about services until we change the investment. We need to do investment. So now I'd like to, are there other questions right now? Because I'd like to take just a few minutes to present some of my own work that might stimulate more questions. And I was asked to address intergenerational poverty, and I wanted to talk about root causes. So I actually feel more comfortable going up here. So, and you also heard that my work in general is about naming, measuring, and addressing racism as a threat to the health and well-being of the country. And so now we're talking about intergenerational poverty. Can you guys hear? Is this one here? That's okay. So what I'm going to do is start with a story. Some of you who heard me earlier may have heard this story that I told. How many of you heard me this morning? A few, okay. So you're going to hear the dual reality story again, and then I'm going to bridge off on that. I am going to ask you, even though we're talking about intergenerational poverty across all communities in this country, I'm going to start talking to you about racism as a system of structured inequity, and then generalize from racism to many other axes of inequity. So I want all of you to hear your counties in everything that I'm talking about, okay? So this story is a story to help people understand that things could be different than what they think they are. And it was a story that made me understand a lot about racism and how that operates. So here, let me set it up. This real thing happened to me when I was a medical student. I was studying with some friends in my apartment. We were studying long and hard. It got late. We got hungry. I had no food in the apartment, so we decided we're going to go into town and find something to eat. Walk into town. We find a restaurant. We go in. We sit down. Menus are presented. We order our food. Food is served here. We are eating, and it doesn't That's not an aha, Dr. Jones. Why are you even telling me a story about that? Most of us have had this experience. But as I sat there with my friends eating in this restaurant, I looked across the room and I noticed a sign, and that sign was a startling revelation to me about racism. So now you're interested, Dr. Jones, what did the sign say? Well, let me tell you what the sign said. The sign said open. So now you're like, oh my God, I've lost most of you. So let me recap. Here we were, sitting in this restaurant eating. I look up, I see a sign that says open. If I hadn't thought anything more about it, I would have assumed other hungry people could walk in, sit down, order their food, and eat. But because I knew something about the two-sided nature of those signs, I recognized that now, because of the hour, the restaurant was indeed closed. But that other hungry people just a few feet away from me would not be able to walk in, sit down, order their food, and eat. And that's when I understood how racism and other systems of structured inequity structure open-closed signs in our society. That racism and these other systems of structured inequity create a dual reality. And for those who are inside, sitting at the table of opportunity, eating, they don't even recognize that there's a two-sided sign going on because it's difficult for any of us to recognize a system of inequity that privileges us. It is difficult for men to recognize male privilege and sexism. It is difficult for white Americans to recognize white privilege and racism. It is difficult for all Americans to recognize our American privilege in the global context. Except we got a little taste of that, at least on the health side of things, with Ebola, did we not? Yet those on the outside, those on the other side of the sign, are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism or any of these other systems of structured inequity, do these really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism or these other systems of structured inequity. It's an empowering thing. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, oftentimes, but if you do, you could even talk to the restaurant owner who is inside, after all, with you. And you could say, restaurant owner, open the restaurant again. There are hungry people outside. Let them come in. You'll make more money, and oh, the conversations we could have. Or maybe what you do is pass food through the door or break the glass or try to tear down that sign, but at least what you won't be doing is sitting back saying, I wonder why those people don't just come on in and sit down and eat, because you'll understand something about the two-sided nature of that sign. So this is something to, especially for people who were born inside the restaurant and who may never even ask, maybe the only thing they're saying is, why don't they come on in and sit down? They don't. There are many ways that people could know about the two-sided nature of these signs. And I once had a 3-hour conversation. We don't have 3 hours to talk about that today, but we should ask ourselves, how can we, first of all, how could people born inside the restaurant know about the two-sided nature of this sign? How do we invite them to open the door and at least see what's happening outside, to listen? Why are people out there saying Black Lives Matter? Don't they know all lives matter? Well, find out, why are they saying that? Obviously, there's something that's encouraging them to say that. How do we in our counties create opportunities for people to burst through their bubbles of experience, to understand that just across town, just outside the door, that there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances? How do we create opportunities for people to experience our common humanity in different circumstances? We can stay a lot there, but I wanted to just define racism, then generalize it to a definition of any of these systems of structured inequity, and then talk about some of the barriers that we face and move us, I would hope, to a more structural approach. When I say racism, I'm talking about a system. I'm not talking about an individual character flaw, personal moral failing, or even psychiatric illness, as some people have suggested. I'm talking about a system of power, a system of doing what? Both of structuring opportunity and of assigning value. Based on what? is the opportunity structured? Based on what is the value assigned? It's based on so-called race, based on the social interpretation of how we look in this race-conscious society. What are the impacts of this system? It unfairly disadvantages some individuals and communities, but every unfair disadvantage has its reciprocal unfair advantage, so it's also unfairly advantaging other individuals and communities. But the third impact is perhaps the most important. Racism is sapping the strength of the whole society through the waste of human resources. We could talk about that on many levels. But then we could say, what is sexism? Well, that's a system of structuring opportunity and assigning value based on gender, which unfairly disadvantages some, unfairly advantages others, and saps the strength of the whole society through the waste of human resources. There are many axes of inequity operating in our society today, intersecting in communities and in individuals, and all of these are operating at the very least as risk markers for how opportunity is structured and values assigned, even as a smaller number of them are risk factors in the progression to disease. My work is on race as the axis of inequity and racism as the system of inequity, because racism is foundational in our nation's history. And yet many people are in denial of its continued existence and profound impacts on the health and well-being of the nation. But I recognize that all of these are going on. So I would recommend, from my stance, that we all are about addressing racism, as well as any of these others that we want to, and to the extent that we can dismantle the system of racism, we'll be successful on many of these other accounts. But I just wanted to say this because actually racism is affecting all of us in all of our counties, but many of us don't see it as well, maybe because we're inside a room, you know, we're inside the restaurant, right? Or we think that because we are in a 99.9% white county, which is because of residential segregation and all kinds of things and other things historically that have gone on, that racism is not impacting us in that. But even there, why would we have a 99.9% white county? You know, what are the historical factors there? So anyway, I'm just saying that all of these things are operating. So now, I'm not going to tell you a story because I don't have time. I would say that there's a very interesting and impactful story that I tell that's about different mechanisms of racism, how it can affect health and other things, but I don't have time. What I want to share with you now is an understanding that if we're trying to, well, there are three huge cultural barriers to achieving health or social equity. The first of these is that we as a society are very narrowly focused on the individual. And when we're narrowly focused on the individual, first of all, it means that even our own sense of self-interest is very narrowly defined, may not even include our cousins or our uncles and aunts, right? It means that we have a very limited sense of interdependence. There, but for the grace of God go I, we're all in this together. And it also means that we have a very narrow sense of collective efficacy. What can I do about poverty, intergenerational poverty? What can I do about racism, as opposed to having a sense of collective efficacy? So the Herkimer County thing is a very important example of saying not what can my agency do or what can my department do, but it's about what can we do together, right? It's already broadening even at the agency level beyond the narrow silo type of thing. But the most kind of under the skin thing that really, this narrow focus on the individual makes systems and structures either seem to be invisible or irrelevant. So that our strategies, and this is what I keep asking this question, how do we get beyond services to individuals or individual families and address structures and systems that are creating, instead of identifying students from poor school districts, how can we make those words not come off our mouth? Instead of identifying at-risk youth, how can we make it so no youth are at risk? How can we go beyond the individual to address the systems and structures that are creating the inequity that we are responding to? And that takes huge investment, different kinds of investment, different people at the decision-making tables, and it takes intergenerational investment. It takes 20-year investment. So now, 18 years, you guys have this, you know, I forgot how you call it, but you know, the integrated decision-making. That's good. What we need is 20 years of investment by these companies that you're trying to bring to the table. Because you won't even see the thing in 5 years or 10 years, right? It is going to take a generation, 20 years. You won't see it while you're the county commissioner, unless you're going to hang on for 20 years. But you have to, or while you're in charge of that department, but you have to start these processes. We have to stop thinking short-term on the individual or short time frames. You know, we want something that's going to get us reelected or something that's going to get us a promotion. But really, when you're thinking about these things that have taken generations to put in place, it's going to take a generation of investment to even start to see some of the outcomes. So we need to measure our success in have we created new opportunity, and not necessarily see if that new opportunity has yet yielded the change in outcome for those children. We have to have the political courage to put in place things that may not have the return to get us reelected, but that we understand that by investing in opportunities as opposed to in services to individuals, that's how we're going to change the curve. The second of the 3 huge barriers to achieving health or social equity is that we are ahistorical as a culture. We look at things and we think the present is disconnected from the past and that the current distribution of advantage and disadvantage is just a happenstance. So then we're encouraging those kids, come on, you know, from the at-risk family, come on, we don't ask how did they become at risk? And what historical processes are being perpetuated by present-day contemporary structural factors that are keeping those families at risk. Whenever we say something about intergenerational poverty, why? We need to ask the why question, not just address it in this generation. So again, you know, I was talking about what we need to do in terms of dismantling things. We need to recognize and rectify historical injustices. When we are ahistorical, it also makes us feel like we can't address systems and structures, that they're, you know, it was this way when I was born, must always been this way, and must always going to have to be this way. But we need to understand that structures and systems can be changed. And finally, the third of the 3 huge cultural barriers we have to achieving social equity is the myth of meritocracy. The story that goes something like this: if you work hard, you will make it. Now, I give you that most people who have made it have worked hard. Not everybody who's made it has worked hard. Okay, we have some prominent examples of that. But most people who have made it have worked hard. But there are many, many, many other people who are working just as hard or harder who will never make it because of an uneven playing field. And that uneven playing field has been created and is perpetuated by racism and other systems of structured inequity. Right? So we need to be unafraid to talk about those systems of structured inequity. Otherwise, for example, if we never say the word racism in a setting in which there's widespread denial that racism continues to exist and have profound impacts on the health and well-being of a nation, and then we never say the word racism, we are complicit with that denial, right? So we need to call out racism and these other systems of structured inequity and abandon this myth of meritocracy to recognize that we do not yet, that is our goal. Our goal is to live in a society with equal opportunity, but that is not yet our reality. We have to acknowledge that babies, when they're born, have equal potential, and what we need to do is to interrupt the systems and structures that are causing their unequal achievement in outcome. So it's a hard thing, but I would say, so now there I am. I think that's all I wanted to say right now. So I want to open it up for other questions because it's hard for us when we have programs and data that we're collecting all the time and reports that we're doing every 3 years?
Every 3.
Every 3 years, and that becomes the job in itself.
Yes.
That becomes, and the documentation, and then the expectation that our little thing here is supposed to show in the next 3 years, or we won't even get funding again. Or, you know, we get our 60 slots, and then we have to show within 2 years that turned things around, or they're not going to bring us the other 254 that we need. Right? We need to get beyond that and really think, how can we move things to have investment in opportunities? So I'm going to sit down and we're going to have more discussion. So. So questions or comments? Let me see what our time
I
is.
just have a statement, because that was the reason I asked the why. Because the county I represent, thank you, the county I represent is facing this structure. But I'm going to make the observation from my county's perspective. So for years and years and years, we never answered the why. So lots of companies never invested, our schools were disinvested, and our economic structures create lots of generational issues. But it wasn't enough for people within the system for 20 and 30 years to say, stop, this is not acceptable. That's the reason I asked that question, why. So I don't need an organization to say, you're going to be part of a pilot project. No one in the county was willing to say that. That was the reason I asked that question, because it is that question that then buys in the Chamber of Commerce, because the level of status quo we exist continues to drive people to do nothing.
Right.
Could I add something then? You had asked me a great question, and I didn't want to go on forever and a day, but with 20 years, you would go on forever and a day with an answer. So I apologize, but when we began, the first thing we did was get someone in from the communities that care, and we looked at the root causes of our youth problem behaviors and issues. We identified 5 risk factors that we work on to this day because they remain the root causes of our problem behaviors. For us, it's family management, it is family conflict, it is early initiation of problem behaviors, it is early and persistent antisocial behavior, so our kids are being diagnosed with greater frequency with mental health disorders, with adjustment or conduct disorders entering school, and extreme economic deprivation. So we talk all the time about generational poverty in our county. Many of our tables are talking about that. We talk about how to engage families. I didn't mention that we, as part of this, but we have parent advocates that work as attached, again, to some structures and funding and programs, but certainly that are there to engage families in a one-on-one basis and say, what's going on with you? You can't get to work because your car broke down. Okay, we know what that means. We also have programs with flexible funding in our mental health services that will pay for rent and security deposits and school clothing and washers and dryers. So that's how we're trying to do it. We're not perfect, but certainly that's how we've tried to do this over the years.
Can you invest? Yeah. Can you hire those parents? Are you hiring those parents?
Yeah. Oh, yeah.
Yes. So
yeah.
that's
oh,
yes.
Yeah. In fact,
yes.
I could name 2 recently. One in our Healthy Families program. A parent who went through the program is now one of the providers of service, and a parent advocate who had a child with a mental health issue now was for years employed with other parent advocates, expanding that program to engage on the mental health side, but then moved to our juvenile justice side because we knew that we had a lot of issues in that area. So,
are there any other burning questions here? Yes. 2. I see 2. One in there.
Mine is more of a comment. I'm about to jump out of my seat. What you just mentioned, what you talked about, Dr. Jones, is just so much where I feel that so much is rooted. It is in racism and in the systems that we as elected officials are implementing, and we're not dealing with the human aspect of what's driving it. And the other question is around ACEs, and the questions that we ask is not what's wrong with you, but what happened to you.
Yes.
Yes.
So it's nothing wrong with people. It's just what's happening to people. So when somebody said, "What's wrong with you?" that just that's not a good question.
And then in the back, I saw.
Yes, I got an overarching question. There are some social scientists who suggest or purport that American capitalism is a win-loss perspective or win-loss proposition to suggest that for a capitalist system to thrive, there has to be a large underclass. So in the American continuum, understanding that the way American capitalism is positioned, what is a strategy to eliminate poverty in such a structure?
As opposed to not being capitalistic anymore, which would be the alternative.
Well, it's
right?
never going to change in America. I'm just saying, with given the dynamics of American capitalism.
Well, you guys want to go for that? I think that in American capitalism, so there are capitalist countries in Western Europe who are doing a lot better, right? Because they provide a lot more investment in social programs, so that when you're born, when you have a baby in England, for example, then you get a year's salary, or yeah, you know, like there's stuff that we don't know about, that, you know, daycare free, and, you know, colleges free, and like all of this stuff, and we don't have that here because we're so afraid of big government, right? And so afraid of, and have this narrow focus on the individual. You know, you got to do it on your own, as opposed to understanding that government is to support all of us and will free all of us. So I think that when we abandon this narrow focus on the individual and say that we can help all of us, and that government is us, it's representing us, and start investing in people. You know, Social Security and Medicare, you know, don't ask an older person to take away their Medicare, right? But that's socialism, supposedly. Well, we have socialism in this country already with Social Security and Medicare. Instead of trying to cap things and all, and to reduce taxes, let's increase taxes and have more benefits so that we have a stronger social safety net and a stronger, right? So that's what it is. So, okay. Well, I don't know, because you know what? Things are so extreme right now that we're going to have to come to a different answer. That we're at a tipping point right now.
A lot of people who own the microphones and the businesses, it's not a lot of people by numbers. It's a lot of people who have the biggest sound system and the biggest influence systems that have that. You talk to every individual person on the world, every one of them have to say it. You might not get the viewpoint out how that works. It's who's got the
And it's who's sitting at the table. And also, I just want to say one last thing before I close this up, unless other people jump up and need a comment too. But the mechanisms of these systems of structured inequity, so the mechanisms of racism, sexism, all, are in our decision-making processes. They're in our structures, policies, practices, norms, and values, where structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not, or who has the biggest megaphone, right? That's the structures. Policies are the written how of decision-making. Practices and norms are the unwritten how of decision-making, and values are the why. And we need to address all of those elements of decision-making. Those are the mechanisms that are keeping things status quo right now. So that's when I was asking, how can we get the young people to the table? How do you get the families to the table? How do you invest in the people in the community so that it's no longer an at-risk community, not just to have services and then one or two gets a job, but how do you say our investment, our program is jobs for all of these parents, right? How do you flip the switch? Well, you would get that as a suggestion if you had some of those poor people at the decision-making table who said, well, give me a job. Then you would get a different thing. So are there other burning comments or questions? I see one here. Yes.
I mean, I just wanted to say this conversation has gotten so real. And like my colleague Brenda, it is hard not to stay in our seats, you know, on this and to jump up. How do you end poverty? There's someone in our community who always says, you give people money. So now we're sort of at the point of talking about reparations. You end homelessness by giving people houses. You know, what about a universal basic income? I mean, until we live in a nation that has policies that help eliminate these structures, I feel like we are at the county level sort of left at the point of trying to have policies ourselves that you know, encourage a living wage at the very least. But we are limited by state and national regulations on what we can do. And so I feel like that's why we turn to programs. you know, and try to at least solve some things for some individuals.
But can a county, do you have power at that local level to be the shiny, tiny little spark, the little light? And they did it in that county, so now another county is going to say, well, let's try that too.
It's a
How did
great
you do that?
idea.
Let's try that too. And then now you start a fire.
We're trying, aren't we, Brenda? We're a blue dot in a red state, you know, in Durham, North Carolina.
Sometimes the political paralysis take over.
And people don't believe they have the power that they have? Is it that?
No, the elected officials are afraid they're not going to get reelected.
But see, that's too much.
That is what happens, though. You can't get
That's
the
reality.
votes.
It is, yeah.
And I know everybody that's elected understands what I'm saying.
Absolutely.
They're going to be cautious about what policy or what program they're going to put out there because somebody don't like it in the community and they're going to push to get you unelected.
So now, okay, here's a comment there, and then I went, so there's a comment there. They want us to stop, but we're having a real conversation. I want to hear what he has to say.
Mark from Buffalo. Mark's from
Thank you. I'm Mark Polenkars. I'm the county executive of Erie County, New York, which includes Buffalo and also a tremendous rural section of the county. A number of years ago, we worked with our local business community to come up with a racial equity roundtable. So we brought them in and said, here's a problem, we need to address it. So we came up with a racial equity analysis impact tool. And first we sold the issue of why racial equity and inclusion was necessary to the business community so they understood it. And then afterwards, after we had their buy-in and we announced the report and revealed the report, we have an economic development plan which is called Initiatives for a Smart Economy. The first iteration was released in 2013. We met all the agenda items, and it also focuses on issues of poverty. So then when we issued the second iteration last year, we now, Initiatives for a Smart Economy 2.0, focus on inclusion, in which every one of the economic decisions that we analyze and why we're going to bring a company into town, how we're going to invest our money from a county economic development level, goes through the racial impact analysis lens. How does this affect people that are disadvantaged? How does this affect people of color? And the advantage of reaching out to the business community before I implemented that economic plan is we had the buy-in from them as to understand why it's important for them to consider this on their own day-to-day level. So when I released the economic plan as the county executive, I did not get pushback from the community that I normally would have because they understood the reasons why we were doing it. And I'd be glad to share that plan, so if people wanted to replicate it elsewhere, just see me.
Other questions or comments in the room? May I just, in response to the last thing, I am not an elected official, so I am surrounded by people who know something that I don't know. But let me ask you this. Could people who run for office think of public service not as a job, but as a mission? And if there were a whole group, so maybe you get elected out, but then you reared somebody else up who could run for election, and then maybe they get elected out. But if we could create a cadre and it weren't an individual thing, that was a job, but if it were a mission, then could we just say, okay, I'll take my turn. Okay, they're gonna kill me. Oh, I'm gone, but the next one is behind me. Could we do it?
We could do it, because I believe it is a mission. We definitely could. We could.
So we don't think about it as a job. Can I get reelected or reappointed? You know, maybe that's how we're gonna have to do it. Until we get enough people with megaphones, the little megaphones, to outweigh the big megaphones, maybe we could do that.
Larry Serapo, St. John Parish. I've been elected about 2 years and about 6 months, and I've been watching all this unfold. And just about everything that you spoke to today, Doc, is within my community. I've got 80% poverty income level in my community. Okay, 70% of the people work outside of the parish. In Louisiana, we're known as Cancer Alley. We're last in education, we're last in healthcare. But you asked a question, Washington. PAC money, Congress. When we eliminate the PAC money going to our congressional leaders, we have a say in America. Until then, America's got a long way to go. Thank y'all.
On that, I want to thank, is there anybody else who wanted to say something? Okay, on that, I'd like to thank all of you for your engagement. Thank you all very much, Jim Wallace and Darlene Hammond. Thank you all for staying.